Hi, I'm Wendy Dallin. I am with Network Anaheim, which is a collective impact initiative in the city of Anaheim. I also work 20% of my time for Anaheim Elementary School District, and so I get the great opportunity of having both of those worlds to connect some of the work that we're doing to serve children, youth, and families across the entire city of Anaheim. Now really my role is with Network Anaheim is, I call it kind of standing at the top of the mountain, looking out at Anaheim and seeing maybe where there's some gaps in services, or when there's funding opportunities that come through or come in, that I help identify what's the best agency to write for that grant, so to bring those dollars into Anaheim. And then sometimes what that is my work is bringing those partners to the table. So kind of being the middleman or the connection, the glue for partners to ensure that the dollars come into Anaheim.
So can you share what theory or perspective did you use as you brought all of these agencies and organizations together?
So one of the big theories that we've looked at is the collective impact model. And I have some documents actually to share with you. And collective impact really looks at having a vision and a strategy for everything that you're doing. How do we support aligned activities so that each agency is actually doing what they do best, and how do we support each other? How do we establish shared measurement practices? So how do we look at gathering some of the data together? And then building public will is, how do we express support for the initiative across the board? How do we help empower each other? Advancing policy through the work, and then mobilizing funding together. So those are the components actually of the backbone function. So it's one of the functions of collective impact. And I talk about that because right now Network Anaheim is functioning as that backbone agency or backbone function for all of the partners.
Can you share which functions served vital during the planning process for Network Anaheim? What was the brainstorming and the organizing process like?
So really this started back in 1999. Before I even was in the city of Anaheim working, I was working in another community, but there was already some relationship building and connection and collaboration with several agencies that included the YMCA, the Anaheim Elementary School District, Magnolia School District, and the city of Anaheim. And they were looking at, they were responding to some of the gang issues that were happening back during that time. And so they created what is now Anaheim Achieves after school program, which operates now, serves like 6,000 students a day. It's all over the city of Anaheim, but that collaboration started. So when I came in and was working 100% for the school district and kind of again seeing some of those trends across the city, what happened is YMCA, City of Anaheim, our school districts, and several other partners, we started meeting together just because we were trying to figure out a way to work smarter, not harder. And so we really started meeting to streamline some of the services. So we could see just organically that we had holes in some of our services. We sometimes didn't know what each of the agencies were doing. So we really started meeting in 2006. We got a large federal grant, which allowed us to partner with Western Youth Services to bring in a mental health component to our schools. And that just kept building on that. So we started meeting really to identify, what piece can you do in this community work? What piece can you do? And how do we engage more significantly with families if we're providing these services? Are these services even meeting the needs of the community? So we really started looking at ourselves, and it was just a very organic group of people, and as people would say, oh, I'm interested in that work, they'd meet with us. So it was very organic in how that started, and then it became solidified when people started. In fact, we used to call ourselves the Village Plan because we didn't know what else to call. We could say, what do we want to call this meeting when we get together and have these conversations? And we decided, well, it takes a village to raise a child. We went back to that old proverb. So we actually called ourselves the Village Plan. And we started, funders started kind of noticing our work. And then that's really what kick-started the next step for that.
Started growing. Can you share with us what organizations or agencies make part of Network Anaheim?
So those agencies that were meeting together on a consistent basis is what we started. So I call those members our founding members. And those were Anaheim Elementary School District, Anaheim Union High School District, Western Youth Services, the Anaheim Family YMCA, the City of Anaheim. We had a business partner also, Complete Balance Wellness Center, Children's Bureau, and Marcus Management Solutions, that team was already providing grant writing and local evaluation for lots of our programs. So they came in kind of using that lens. So those were really the founding members those were the people from those agencies were the ones that we were meeting kind of after hours talking, how do we do this differently? Anaheim's so big. What do we do differently? How do we get out of our silos and work a little more openly and collaboratively together to have a stronger impact in the community? And then recently we added Magnolia School District. Now they sit on our steering committee. So those founding members made up our Network Anaheim steering committee that meets monthly. So they're the guide kind of the work that we're doing.
Can you share with us, how did you come to the realization that there was a need for Network Anaheim?
So again, when I came to the City of Anaheim and I was working for the Anaheim Elementary School District. That was in 2005. And I was working in pupil services, student services. And so my job was partially to oversee things like homeless education, our community liaison. So I was already connected to like some of the community work that they were doing in the schools. And that is kind of like I shared earlier, when I started working with all these agencies who also had a passion to figure out how do we do this bigger, greater. So if I'm the education component, let me do what I do very best. And then, YMCA, you run after school programs, you do what you do best. Western Youth Services, you're the mental health. So as that grew, that's really what got to Network Anaheim. So I'll share a little history. I started sharing about the collaboration in 1999 that created Anaheim Achieves. As we started meeting together and became the Village Plan, and literally we're just having very unstructured meetings just to kind of, what are you doing? Oh, wow, that's a great class. Can I bring that to this school? Or we're doing something at school. Can we bring that into this? So just talking through how we do that. That's when we got some notice by funders started to kind of hear about this. And so they came to us and said, we'll give you funds. This was the Children and Families Commission of Orange County, who was already funding many things in the school district for children 0 to 5. And because that was just a 0 to 5 component, they got a partner, the Samueli Foundation, so that they could fund us to write a business plan so that we could do all ages. And so we actually hired a consultant and wrote a business plan, and through that business plan process is when we decided to call ourselves Network Anaheim.
So lastly, can you share what are some of the key functions or goals of Network Anaheim, and what are some of the needs of the community that Network Anaheim is trying to address?
So Network Anaheim is not a direct service provider, and I think that's what sometimes gets confusing. But really, Network Anaheim was created to be the glue between service providers, anyone serving children, youth, and families, and to keep the vision moving and to keep kind of incorporating learning. So helping build capacity with agencies and figuring out what the gaps are and those kinds of things. And then we also focus areas, and I'll share this with you, but our focus areas we identified early on in our work that we were doing with our business plan, that our focus areas would be around move well, eat well. So looking at children, youth, and families having good nutrition and being physically fit, and then think well, so the social emotional needs of children, youth, and families, so making sure we were identifying those, and then learn well, helping children be ready for school, so that very young age, and then also college and career ready, and then later we added live well. So we realized that we probably had a component where we needed to support families being self-sufficient and economically stable. And so we later added that. So that's an area that we probably have our least expertise in our steering committee, but we're broadening that now. We have a Wells Fargo Foundation kind of just heard about us, and they're interested in helping that. And we call those pillars. So we called them the 4 pillars of health and well-being. And so we have actual work groups in each of those pillars that are working on different functions to move some of that forward. So each of those looks a little differently. The move well, eat well pillar, we brought in some of the initiatives that were already happening in Anaheim. So we didn't create something new, but brought in some of those initiatives around childhood obesity, around healthy eating, active living, heal zone work. So we brought all those partners together. So really that's my job in Network Anaheim, is to bring the partners together and then help them identify, what do we want to work on? What do we want to improve? Let's look at some data. And so there's we have a work group for each of those that functions, again, a little differently, and hopefully kind of healing, helping Anaheim, just have prevention, so that we're looking at, now we've recently brought in all the ACEs, the Adverse Childhood Experience work, to use as our lens through all those pillars, because it fits. And then we're also using the Early Developmental Index, EDI, data, which tells us what how the community's functioning, and that's done through assessments with children in kindergarten. So they assess, so it's not about kindergarten, it's about what the community function is. So, do we need more parks because kids need more large motor movement, or, kind of those things, or do we need more social connections, or, do we need more literacy? So we're using those two as some of the lenses that we look through to support all 4 pillars.
Wow.